Dr. Staci, can you tell us a little bit about the X39 stem cell activation patch patent, as well as the key research studies? And maybe just tell us a little bit, in layman's terms, what a few of those studies say.
Yes, absolutely. I'd love to. Yeah, so if you're familiar with patents at all, you know that you have to prove certain things or make things that are very exclusive and individual, right? They're very proprietary. And so David has himself personally over 130 patents. And we know there are at least 70 plus that are in the area of regenerative medicine with stem cell technology. So if you go to the website startx39.com, you'll be able to see these patents on our patches. They're licensed, okay? So we do have patents on our stem cell activation patch, the X39 and the others. But as far as studies go, you'll find those as well too. Now they're over 90. I'm going to give you just a couple that I really love. And one deals specifically with the brain and being able to use neurofeedback and also use EEGs to be able to monitor and look at the functionality of the brain using the X39 stem cell activation patch. And you can see over the course of the weeks and even into months, the progression. So you look at a brain and it looks colorful, like you would if you looked at the person in night vision goggles, right? Except it's really important with the brain, the colors that we're looking at. And we want to make sure that those colors are light blues and greens and yellows. And so one of the studies that I absolutely love was this person. And of course, the brain was red. There's a lot of red, a whole lot throughout the brain, which shows incoherence. Incoherence means that things are synchronized, right? That they are working correctly. And so this brain was out of coherence. You could see there was anxiety, there was stress, there was the nervous system was really out of balance. And so using the X39, you could see the course of, a few weeks later, there was more coherence. The colors had started, the red was less. It was dissipating, and then you could start to kind of see some yellow come in and maybe a hint of green. And then when you're looking out 6 weeks and beyond, you could really see that change to the blues and the greens and the yellows in the brain. So the longer using the X39, the more coherent the brain became, which means the more that it's functioning correctly, doing the things that it's supposed to be doing to communicate with the body. And also the more imbalanced the person became in their nervous system, right? And their anxiety and their stress and their communication and interactions with all things, okay? Then the other study that I really love is with the heart. And David did a study with participants. And, you heard Mel say how the improvements are first 3 weeks, we really start to see things, improve with the digestive and the nervous and the immune system. But then what happens after that? So this study takes place not during the first 3 weeks or 4 weeks or even 5 weeks, but at 6 weeks of using the X39. There were remarkable differences in the functionality of the entire vascular system. And so you can see in this study that every 6 weeks using the X39, your vascular system is functioning as if it were 8 weeks younger. So let's think about that compound effect. Day after day, week after week, month after month, year after year. What is happening to the heart and the entire vascular system? If every 6 weeks we can see it's functioning 8 weeks younger, that compound effect is astronomical. We know the #1 killer in the United States is heart disease, especially for women, right? So such emotional beings, and so we carry so much in our heart. So if you can work on the physical heart and the vascular system, what does that mean for your longevity, for your vitality? You heard Mel say that David has the tech that we're supposed to look and feel 25 and live to 250. We can't live to 250 unless your heart's functioning correctly. So boy, those stem cells sure are going to work on one of the very most important things in our body, right? That's why the heart and the brain. And so for me, these are my 2 favorite studies because heart-brain coherence is very important, right? Staying centered, staying connected to divine, staying very heart-centered and focused. And so knowing that this patch is working physically on the heart and the brain, it's also working emotionally and mentally on the heart and the brain. And I love that. So those are my 2 favorite studies.